Good morning, ladies and gentlemen. Today we're going to discuss the need to implement a new electronic medical record system. Let's talk about ourselves first for a minute. As you all know, we are a 400-bed community hospital that serves approximately 86,000 patients in the Waipahu Pearl City area here in Leeward, Oahu. Although our potential population is 86,000, last fiscal year we saw 1.5 million patients, which tells me that patients from as far away as Waianae and Kapolei have been frequenting our facility rather than the ones in the neighborhoods. Nearly all of our patients are either paying us via Medicaid or Medicare or through a paid insurance plan. Last fiscal year, only 1% of our patient population was indigent. There have been numerous complaints from our patient population concerning the operation of our facility. Everything from the lack of parking and the rooms being too small and uncomfortable to the fact that the patient has to keep his or her medical records with them at home and not here as other facilities do. Certainly, we have the funds to make changes, renovate the facility, and make it more comfortable. But the fact is, over 1 million patients came to us last year for care in spite of the rather rundown state of our facility. In order to keep them coming, we need to correct the majority of their complaints, which all have to do with the lack of an EMR system at our facility. The facility is in need of an upgrade, but we can wait a few more years. Right now, we are in need of an electronic medical and health records keeping system. To be perfectly honest, we are way behind the times, and since the implementation of the HITECH Act in 2009, we are in fact in violation of the law. We need to get on top of this immediately. The Health Information Technology for Economic and Clinical Health Act, or the HITECH Act, enacted as part of the American Recovery and Reinvestment Act of 2009, was signed into law on February 17, 2009 to promote the adoption and meaningful use of health information technology. Thus far, we are still using paper records, and using paper records in the 21st century is in violation of the HITECH Act. Don't get me wrong. This will not be an easy task. We will need to work closely with the IT professionals and our board of directors to discuss the needs of our particular facility and which system will best suit our needs. We will need to put together a team to oversee the purchase and execution of the project, and this team, along with the board, will ensure that the new system will meet the organization's needs and address all concerns. This will need to work hand in hand with the financial department to ensure that the financial and strategic planning of the organization are considered and implemented. Some of the issues we have are the initial cost of the implementation. To be honest, with a $2.25 billion operating budget, we can easily afford the necessary funds to make this happen. Unfortunately, we only have the funds for one improvement, so we will have to delay the physical site improvement for at least the duration of the implementation of the EMR system. The learning curve for the staff is another concern. So the implementation team will need to take this into account and find a system that, be it a physical on-site system or a software-based system such as OpenVista, that will be best suited for our team and the easiest to implement and maintain. This is my idea. And if you have any questions, I will very happily answer them now. Thank you.